Hello, I'm Dr. Larry Anderson, Associate Professor of Medicine at Texas Southwestern Medical Center. Here I will summarize the findings presented in our abstract entitled Idecabtagene vicleucel, or ide-cel, a BCMA-directed CAR T-cell therapy in relapsed and refractory multiple myeloma, updated KarMMa results. Here we are reporting results for a longer-term analysis of patients treated with ide-cel in the pivotal phase 2 KarMMa trial, now with a median of 24.8 months of follow-up, the longest follow-up to date from a global clinical trial of CAR T-cell therapy of myeloma. Historically, patients with relapsed refractory multiple myeloma exposed to an immunomodulatory agent, proteasome inhibitor, and an anti-CD38 antibody have poor outcomes with subsequent therapies using previously approved regimens, with expected response rates in the 25 to 31% range, progression-free survival expected in the 2 to 4 month range, and overall survival less than a year on average. Ide-cel, a BCMA-directed CAR T-cell therapy, has demonstrated favorable tolerability and deep, durable responses in heavily pretreated patients with relapsed refractory multiple myeloma, and was approved by the FDA recently for patients with relapsed refractory multiple myeloma after at least 4 prior lines of therapy. This trial, the KarMMa trial, only required 3. So one of the objectives was to determine if there were any differences in patients that had received only 3 prior lines of therapy compared to those that had received 4 or more. In this KarMMa study, 128 patients with relapsed refractory multiple myeloma were treated with ide-cel across a target dose range of 150 to 450 million CAR T cells. These patients had received a median of 6 prior lines of therapy, ranging from 3 to 16. The overall response rate was 73%. Median progression-free survival was 8.6 months as an average across all target doses of CAR T cells. However, the highest target dose of 450 million CAR T cells, the overall response rate was 81%, with a complete response rate of 39%, progression-free survival of 12.2 months. Outcomes did not vary significantly based on number of prior lines of therapy of 3 versus 4 or more. Responses to ide-cel were durable, with a median duration of response of 10.9 months among all ide-cel treated patients, and increased with depth of response to 21.5 months for those achieving a complete remission. For those achieving CR, 41% remained in remission at 2 years. Median overall survival in this study was 24.8 months among all ide-cel treated patients, and 22 months and 25.2 months in those that received 3 versus 4 or more prior lines of therapy, respectively. Median overall survival was also over 20 months in most high-risk subgroups, including those with extramedullary disease and triple refractory. Incidence of cytokine release syndrome and neurotoxicity was similar in patients who received 3 or 4 plus prior lines of therapy and were mostly low grade. Although 84% of patients experienced cytokine release syndrome, only 6% were grade 3 or higher. And fortunately, only 18% of patients experienced any grade of neurotoxicity, with only 4% grade 3 and no grade 4 or 5 neurotoxicity in this study. So the safety profile of ide-cel was similar, regardless of the number of prior lines of therapy, and remained consistent with longer follow-up. And we saw similar rates of infections and second primary malignancies, and no unexpected gene therapy-related toxicities in this study. In conclusion, long-term results from the KarMMa trial continue to demonstrate frequent, deep, and durable responses in heavily pretreated patients with relapsed refractory multiple myeloma. The safety profile of ide-cel was consistent with previous reports across all groups. The favorable benefit-risk profile of ide-cel, regardless of the number of prior lines of therapy, supports its role as a treatment option for heavily pretreated relapsed refractory multiple myeloma. As a separate sub-analysis presented at this ASCO meeting, we also looked at the outcomes of neurotoxicity, or ICANS, in these patients receiving ide-cel, and we did not see any changes in progression-free survival or overall survival in patients that had neurotoxicity, and we did not see any more than that 4% high-grade neurotoxicity. So the side effects were very manageable and as expected and reported.